Hi, good afternoon. This is Katrina Albright, and today's date is May 21st, 2021. We're going to go over 5 systems, and this is my daughter. She's going to be the model for today. The notes I have today are just a list of the 5 systems or 5 external structures that we're going to be talking about. The first one is going to be the shoulder. Now, the shoulder is going to be made up of our clavicle, the scapula in the back, or the shoulder blade. Clavicle also is the collarbone. We have our long bone here. It's going to be our humerus. There are 2 joints that make up our shoulder joint. So our AC joint, where acromion comes across to our clavicle. There are 3 different grades of injury when we talk about the separation of the AC joint. And that 3rd grade is going to be the one that is going to require surgery. So how we're going to treat that as a clinician is just going to be to put our arm in a sling. We don't want it to get all tight and frozen shoulder. So a couple times a day, we're going to have our patient take their arm out of the sling, move it around, put it back in. This gives the body time to heal. The second joint is going to be our glenohumeral joint. So think of a ball and socket. So the glenoid cavity and then the humeral head is going to allow us to move this arm right at the shoulder joint. So when we're talking as a clinician, our patient comes in and we see that the head of the humerus has come out and we have an anterior dislocation, they're going to be, that's going to come forward and then their arm is just going to hang. They're not really going to be able to raise it, things like that. So as a clinician, what we're going to do is pain meds, and then we're going to take an x-ray to confirm that we do have that anterior or posterior dislocation. From there, we're going to do our reduction, whichever way is appropriate for our patient, and then post-reduction films. We are also going to, again, use a sling. It just allows that shoulder and the muscles and the tendons to reduce an inflammation. So ice, some NSAIDs, a couple times a day. Again, take it out, gentle motion, just to strengthen that back up. A couple of days, you should be feeling fine. Our second one we're going to talk about is going to be our biceps muscle, our biceps brachii here. So this is part of our muscular system. The shoulder joint was part of the appendicular skeletal system. So this is part of our musculoskeletal system. Our biceps brachii is a parallel muscle, and it is attached with 2 tendons at the top. So our long tendon head is going to come attached to the top of the shoulder joint, and then the short head is going to come attached to the front of the shoulder. When we have a patient that comes in with a torn bicep, whether from it just getting worn out or an acute injury, we're going to see a ball here. They're going to be in pain. They're not going to be able to use their arm like they normally would. And what has happened typically is the long tendon head has snapped off, worn off, and is pulled down. Unfortunately for the patient, the muscle, that tendon, isn't going to reach up and reattach itself. It does need a surgical intervention. So we're going to send that patient to surgery. The third that we're going to talk about is going to be our ear canal. So when we think of our ear canal, we think of hearing. But our ear has so much more than that. It is part of the auditory system. That audio nerve is going to send signals to our brain. It's also going to be part of our nervous system. The brain is going to receive those signals. And then since it is exposed to the external, we're going to talk about the integumentary. So our ear has so much more to do with our body than just hearing. So when we talk about balance or dizziness, we can talk about cerumen impaction. We can talk about, we look at that tympanic membrane and see it's ruptured. Do we have pus? So if I pull on it, ow, that hurts, and I take my scope and I look inside and I can barely get that speculum in because it's so swollen with that tumor here. I know as a clinician that we've got an infection going on. We need some drops and stay out of the water, things like that, just till that heals up. So this is a case of, yes, it's an external structure, and we can see some things directly that leads us to think, oh, our problem is right here, but also with the dizziness or that balance. The ear canal, the ear structure itself, points us to a deeper problem that isn't just right behind the ear, right behind it. It points us more, in towards the brain and in towards, the structures in our ear that are causing us to be dizzy. The next one we're talking about is the skin. When we look at people, we see their skin all over. It's our covering, part of the integumentary system. Again, this is going to be one with dual purposes for us. Yes, it's a burn. We can see the burn. We look at the burn. We can treat the burn. But say my patient comes in and she's quiet after eating. Her lips are blue. Around her mouth is blue. That points us deeper. That says I've got an airway obstruction. I'm not oxygenating like I should be. So knowing that the deeper structures are getting impinged or impeded leads us to act quickly to get that respiratory system back open so she can breathe. My patient comes in, they're gray, they're ashen. Well, we know that it's not just their skin that's the problem. Something's going on cardiac-wise because the blood is getting shunted to help with that cardiac system. From there, when we give radar report, my patient is pink, warm, and dry. That gives the overall impression that our patient is fine. They're oxygenating well. They're warm enough. They're not cold. So the last one we're going to talk about is going to be the nose. So the nose, again, is one of those structures that, yes, we can treat right here, integumentary on the top. Are we having issues? Or is there edema? Are we having an allergic reaction? We can see that, which, again, leads us to think, okay, we need to get some medication on board to reduce that inflammation because something is going on. Those histamines are getting released. Or was she in a fight where we need to take x-rays because we can see the edema and the bruising and we can see down deeper. So is she breathing deep where she's pulling more oxygen in, so her nose is flaring, her nares are flaring in an attempt to pull that in. So again, the external structure shows us, yes, it's just her nose and her nares are flaring, but why? As a clinician, I need to be able to say something is going on that's making her body try and open up to get more oxygen in. So as a clinician, I need to be able to say, yes, the surface anatomy is very important and I can see the structures and I know where they are, but maybe that problem isn't just right behind those structures. Maybe the body's core systems, the respiratory system, the cardiac system, maybe they're pointing me towards the deeper problem by using those surface anatomy and surface structures.